Hello, I'm Dr. Gemma Newman and I'm a GP and broadcaster, and today I'd like to help you with a few top tips to improve your health. I'd like to talk to you about how to cure morning sickness. Now, morning sickness is a really common problem in early pregnancy, and unfortunately most women suffer from it, and also it's not always in the morning. The good news is it does tend to settle in most cases about 8 out of 10 by week 16. But what can you do in the early stages to improve your situation? Well, the first thing I would suggest is to drink plenty of water. This will reduce any kind of dehydration. Dehydration in early pregnancy can make nausea worse. The other thing I would suggest is to eat little and often. If you have a big meal, then that's more likely to make you feel sick. The other thing I would suggest is ginger. Ginger can come in many forms, tablets or biscuits or in the raw form, and I would suggest that some women do report that does improve nausea symptoms. Another thing you could try is acupressure. You can buy these kinds of acupressure bands to wrap around your wrist, and they're often used for travel or motion sickness as well. Something else that you might want to try is a herbal tea. Now that could include ginger, but also something like chamomile to relax you, or peppermint to relieve bowel spasms. Another thing that you can try is sleep. Now often if you're lacking in sleep, it does tend to make the morning sickness worse. So it's worth getting a good night's rest as well, especially because in early pregnancy you do tend to feel more tired. Now, there are some worrying problems that you might get with severe morning sickness, and if you're not able to eat anything and if you're not able to drink, then that can leave you severely dehydrated. And if that's the case, you should really go and see your own doctor for advice and support. Your doctor may recommend that you take anti-sickness medications, but it's always best to take the minimum possible dose for the minimum possible time, as any medications we do try to avoid in pregnancy. Having said that, anti-sickness tablets are very effective, and if you are getting dehydrated, it's more important for your health and for the health of your baby that you take medication if you need to. Now, also another point I want to make is that it's important to rule out other causes. So if you're early in your pregnancy and feeling sick but you have other symptoms as well, things like fever or jaundice or pain when you pass urine, anything else like that, then it's really important that you go and see your own doctor. Good luck, and I hope that you stop feeling sick very soon.